Hello and welcome friends. Welcome to this video on some simple definitions in nucleotide metabolism. So let's begin. De novo synthesis. This refers to the synthesis of complex molecules from simple precursors. The major pathway for purine and pyrimidine biosynthesis is denoted as de novo synthesis, as these nucleotides are synthesized from different small components. Humans are prototrophs. Prototrophs are organisms capable of synthesizing the metabolites from inorganic material. De novo synthesis of purine nucleotides. The purine ring is assembled on ribose 5-phosphate by the contribution of different atoms from carbon 4, carbon 5 and nitrogen 7 by glycine. Nitrogen 1 is contributed by aspartate, nitrogen 3 and 9 by glutamine, carbon 2 and carbon 8 by tetrahydrofolate, and carbon 6 by carbon dioxide. Deoxyribonucleotide synthesis. Deoxyribonucleotides, which are the building blocks of DNA, are synthesized by the reduction at 2' carbon OH group, that is hydroxyl group present at the second carbon atom on ribose moiety catalyzed by ribonucleotide reductase complex. This reduction also requires a protein cofactor thioredoxin, a flavoprotein thioredoxin reductase, and reducing equivalent NADPH. Degradation of purine nucleotide. Uric acid, that is 2,6,8-trioxypurine, is the final excretory product of purine metabolism in humans. The nucleotides AMP, IMP and GMP are converted respectively to AIG, that nitrogen bases, by nucleotidase enzyme. Nitrogen base A is deaminate to I and G are converted to xanthine by phosphorylase and oxidase. And finally, xanthine oxidase converts hypoxanthine to xanthine and xanthine to uric acid. Salvage pathway. The purines can be directly converted or recycled from degraded DNA of broken down cells to the corresponding nucleotides. Adenine phosphoribosyl transferase catalyzes the formation of AMP from adenine. Hypoxanthine guanine phosphoribosyl transferase, HGPRTase enzyme, one of the very important salvage pathway enzyme, converts guanine and hypoxanthine respectively to GMP and IMP. Significance of salvage pathway. Hypoxanthine guanine phosphoribosyl transferase, HGPRTase enzyme, the salvage enzyme, channels hypoxanthine and guanine back into DNA synthesis. The salvage pathway provides purine nucleotides for tissues incapable of their biosynthesis by the de novo pathway. The tissues include brain, erythrocytes and polymorphonuclear leukocytes. Gout. It is a metabolic disease associated with overproduction of uric acid. In severe hyperuricemia, crystals of sodium urate get deposited in soft tissues, particularly in the joints. Such deposits are commonly known as tophi. This causes inflammation in the joints, resulting in painful gouty arthritis. Sodium urate and or uric acid may also precipitate in kidneys and ureters, that results in renal damage and stone formation. Primary gout. An inborn error of metabolism due to overproduction of uric acid. There is increased activity of PRPP synthetase, that is phosphoribosyl pyrophosphate synthetase, increased synthesis of PRPP glutamylamidotransferase, increased activities of glutathione reductase, and decreased activity of HGPRTase, that is Lesch-Nyhan syndrome, we'll be seeing later, and decreased synthesis or absence of glucose 6-phosphatase von Gierke's disease. Secondary gout. Secondary hyperuricemia is due to various diseases causing increased synthesis or decreased excretion of uric acid. Sorry. Elevated destruction of cells is accompanied by an increased degradation of nucleic acids to uric acid, as observed in various cancers like leukemia, polycythemia, psoriasis, and increased tissue breakdown. Decreased excretion of uric acid occurs in disorders associated with impairment in renal function. Treatment of gout. Gout can be treated Gout can be treated by a combination of nutritional and drug therapies. Foods rich in nucleotides and nucleic acid like organ, liver, beverages like tea and coffee are withheld from the diet, and restriction in alcohol intake is advised. The drug of choice for the treatment of primary gout is allopurinol. Allopurinol is the structural analog of hypoxanthine that competitively inhibits the enzyme xanthine oxidase. Pseudogout. This disorder is caused by the deposition of calcium pyrophosphate crystals in joints. The clinical manifestations are similar to gout. However, serum uric acid concentration is normal. Lesch-Nyhan syndrome. This disorder is due to the deficiency of important salvage pathway enzyme hypoxanthine guanine phosphoribosyl transferase or HGPRTase. It is a sex-linked metabolic disorder affecting males. It is characterized by increased uric acid production, neurological symptoms like mental retardation, self-mutilation, aggressive behavior, spasticity, and learning disability. Severe combined immunodeficiency syndrome or SCID. It is because of deficiency of enzyme adenosine deaminase or ADA. In this disorder, there is accumulation of deoxy-ATP, which is an inhibitor of ribonucleotide reductase enzyme. DNA synthesis and cell replication is impaired. There is low DNA synthesis, low lymphocyte proliferation, low immunity, and impairment in T cell and B cell functions or impaired functions of T cells and B cells. Hypouricemia, that is decreased uric acid level in the serum less than 2 mg per deciliter. It is associated with a rare genetic defect in the enzyme xanthine oxidase. There is increased excretion of xanthine and hypoxanthine. Xanthinuria frequently causes the formation of xanthine stones in the urinary tract. Von Gierke's disease. There is decreased activity of glucose 6-phosphate or literally absence of glucose 6-phosphatase enzyme that leads to increased pentose phosphate pathway or HMP shunt. There is increased formation of ribose 5-phosphate that leads to increased production of PRPP and increased uric acid production, leading to hyperuricemia. De novo synthesis of pyrimidine nucleotides. The pyrimidine ring is first synthesized and then attached to ribose 5-phosphate, in contrast to purine nucleotides. In that case, what happened? In this case, pyrimidine ring is first synthesized. There, ribose 5-phosphate forms the base, and on that base, all the molecules are added. Now, in pyrimidine nucleotide synthesis, it is formed by the contribution of different atoms from the nitrogen 1, Carbon 4, carbon 5, carbon 6 are contributed by aspartate, nitrogen 3 by glutamine, carbon 2 by carbon dioxide. So pyrimidine ring is first synthesized and then attached, whereas purines are added to the pre-existing ribose 5-phosphate. Degradation of pyrimidine nucleotides. The pyrimidine nucleotides undergo dephosphorylation, deamination, and cleavage of glycosidic bond to liberate the nitrogenous bases, CUT. The bases are then degraded to highly soluble products, beta-alanine and beta-aminoisobutyrate, which undergo transamination and other reactions to finally produce acetyl coenzyme A and succinyl coenzyme A. Salvage pathway. The pyrimidines, like purines, can also serve as precursors in the salvage pathway to be converted to the respective nucleotides. This reaction is catalyzed by pyrimidine phosphoribosyl transferase, which utilizes PRPP as the source of ribose 5-phosphate. Orotic aciduria. This is the rare metabolic disorder due to the deficiency of enzyme orotate phosphoribosyl transferase OPT and OMP decarboxylase. It is characterized by the excretion of orotic acid in the urine, severe anemia, and retarded growth. Orotic aciduria types. Orotic aciduria type 1. This disorder is due to the deficiency of orotate phosphoribosyl transferase OPT and OMP decarboxylase. In orotic aciduria type 2, there is deficiency of only OMP decarboxylase. So based on the deficiency of enzymes, they have been subclassified into two types. Both types are inherited as autosomal recessive disorder. Hereditary orotic aciduria. It's extremely rare. There is defect in the de novo synthesis of pyrimidine nucleotides. There is deficiency of UMP synthetase, characterized by severe anemia and retarded growth. It's treated by giving UMP. Reye syndrome. This is considered as a secondary orotic aciduria. It is believed that a defect in ornithine transcarbamylase of urea cycle causes the accumulation of carbamoyl phosphate. The excessive carbamoyl phosphate is then diverted for the increased synthesis and excretion of orotic acid. Anti-cancer drugs. Enzymes of nucleotide biosynthesis that are inhibited by anti-cancer drugs are thiamidylate synthase, that is inhibited by fluorouracil, dihydrofolate reductase, inhibited by methotrexate, and glutamine amidotransferase is inhibited by azacitidine and acivicin. So all these molecules are anti-cancer drug. There are mercaptopurine that inhibits the conversion of IMP to GMP and AMP, and 6-thioguanine and 8-azaguanine, which are also synthetic nucleotide analogues. So with this, friend, let me take the opportunity to acknowledge all these resources for making this video possible. Thank you, friends. Thank you for watching this video. Be happy, healthy, and stay safe. And remember, biochemistry is easy. Thank you so much.